Hello po and welcome to Ask Dr. Ana. Q&A po tayo, Halloween edition. So we are willing to answer po all your questions about COVID, non-COVID, mga kagat, breast cancer, anything po that you'd like to ask. I'm Dr. Ana York Bondoc. Our program po is called Libreng Consulta and we try to meet every weekend po to answer the questions that have been sent to us po on FB and now our newest sa TikTok po. Okay? So please put your questions down below. We'll be happy to answer them. Maikli lang po yung mga sagot because there will be a lot of questions. And then number 2 po, please remember na yung mga sagot po natin, it is not specific po sa inyo. Ano po talaga is, it is a general, just to give you po an idea of how and what you should do. Pero hindi po ito payo ng doktor ninyo. Payo po ito para sa lahat po ng nakikinig. Okay? So, let's start. And I like the blue blouse and the pink writing, so that's fine. Patapos na po ang October is Breast Cancer Awareness Month. We have had 3 topics po on breast cancer. The first is breast cancer surgery with Dr. Emmy Cua de los Santos. She is a surgical oncologist. Followed by mammography or mammogram. At the title is actually, Doktora, natatakot po akong magpa-mammogram. Huwag po kayong matakot. Yun po ang sagot ng atin pong breast radiologist, Dr. Joanne Uy Valdez. She's a good friend. And lastly, the third po for the Breast Cancer Awareness Month was stories of breast cancer with my cousin, Miss Emily Aliwalas Bais. And Mrs. Purit, first cousin po ng papa ko, Aliwalas Bais. So si M po, my cousin, was diagnosed with breast cancer with the support po of her mommy, friends, and family, including our first cousin po who's a breast cancer surgeon, si Dr. Norman San Agustin, ay nalipasan po niya yung kanyang problema and to move forward po to be a healthy single parent to her 3 kids. So yun po yun. Next month, we are scheduled po for pediatric eyeglasses. That's on November 7 with Dr. Pauline Santiago po. Pauline is one of the most prominent and well-known pediatric ophthalmologist, mata ng bata po. So pag-uusapan po natin kung kailan po kailangan ng anak nyo ng eyeglasses, how to detect, what to buy, what to do. Ayan po. She's also going to discuss with us kung dapat pong magpa-check up lang sa mga mall clinics or sa mga mall stores selling eyeglasses, or what is the benefits po of going to a pediatric eye specialist. So yun po yung pediatric eyeglasses, that's on November 7. And we'll have other talks pa po regarding health nitong November 7. I'm happy also to invite you to TikTok. Our latest was nakagat ng jowa. So kung makagat po ba yung jowa nyo, please listen to our TikTok. So let's be ready with the first question. Miss Reina, are you ready? Please put your questions po. We are happy to answer them.
Question, Doktora, yung mother ko had breast cancer at 42. What age ang start ng mammogram?
Magandang ano ito. And this was actually asked by Miss Kathleen, who is actually my assistant. And yesterday, napag-usapan nga po namin yung mammogram. Gusto na daw niyang magpa-mammogram. So, okay, what's mammogram? Mammogram po is x-ray ng inyong dibdib or suso or boobs. Opo. Para makita po yung mga possible na maliliit pong cancer. Yung mga iba, gusto na lang pong kapain ang kanilang dibdib, but unfortunately, not all the bukol is nakakapa. So that is why we need to have a mammogram screening. Ang screening po, kahit wala pa po kayong makakapa, even if you feel perfectly okay, you need to start doing a mammogram kasi the earlier that you diagnose the problem, talagang highly curable. Pag late na po, syempre, mas mahirap. So what age should you start the mammogram? Kung normal po kayo, walang nararamdaman, no breast cancer, you start at 40. Okay, ngayon, eto po, family history. The mommy had breast cancer. So sinasabi po nila, if your mom had breast cancer, pre-menopausally or before na menopause po si mommy, minus 10 from the age po ni mommy. So mommy was 42 nang na breast cancer. So si anak po na babae should start her mammogram at the age of 32. So, minus 10. So, in your 30s. So, kung wala po kayong nararamdaman na problema, your mother is fine, your sisters are fine, start at 40, and earlier po, no, minus 10 from the age of mommy, if your mom was diagnosed early. Okay? So, yun po. Sa inyo, 42 si nanay, so dapat 32 pa lang, start na kayo.
Hello po. Ano po ba ang makakasama at makakabuti sa isang may goiter?
Yes. Okay. First of all, no, I would like to know, kasi marami pong nakakakapa dito. The most important po is you need to see a doctor to make sure hindi po cancer yung nakakapa nyo and goiter lang. Actually, what is nakakasama? Depende po for the reason for the for the mass. Yung iba po, then you need to check your thyroid levels kung kayo po ay hypothyroid or hyperthyroid. So, majority naman po talaga ng Pilipino ay hypothyroid. So, you need to, may gamot po that will regulate po yung inyong thyroid hormone. You need to see a doctor at may blood test po yan and they will give you small doses po to regulate your thyroid hormone. I am not an endocrinologist. So, you know what? Let's invite a thyroid specialist kasi that's something also that I'd like to learn about. So, yung iba nag-aalaga po ng bukol sa sa thyroid, please, have it checked kasi baka po cancer yon. And again, it's highly treatable pag maagang makuha.
Another question. Hello, Doktora. Hikain kong anak ko, ano po ang dapat gawin?
For those putting the questions, could you put the name para alam po natin who asked the question? Para po mabati natin. Miss Rina, could you check that? Okay, so hikain po yung bata. Number one, please, marami talagang hikain pag bata. But be comforted by the fact that most of the children po outgrow this hika. Okay, number two, find out po kung ano po yung triggers ng hika po ng inyong anak. Okay, these are very common triggers. Pets in the house. I always ask, may aso at pusa po ba kayong inaalagaan? If you're taking care of a dog or a cat inside your house, I would recommend ilabas po yung aso at pusa doon sa inyong garage, garden, or whatever, and do not allow the dog or the cat inside the house. Okay? And then, number three po, what I could suggest is, if you po, another thing, no, number three, other triggers. Try to stop your child po from having colds or cough. Kasi po, ang post-infection hika is also possible. Kasi po, parang naiirita po yung passages ng inyong baga and that from the infection, usually a cold, and that can cause hika. Number 4 din po, your child could be allergic to dust. Clean your house. And pollen, be aware po, and it's seasonal po sa US ang pollen. Okay? So, yun po, that's what you could do. The best I suggest is linisin yung bahay, remove the pets, clean the house, find out what your child is allergic to. And number 3 is, have a checkup din po, no? Kasi I don't want to be mentioning gamots. Ventolin is really the most popular. But the best po talaga, kung frequently na pong hinihika yung bata, then you need to be followed po by a pediatrician or a pediatric allergy or pulmonary specialist. Okay? So, ayaw po na magpabanggit ata ng mga pangalan ng mga tao. Ito lang sabihin ko, if you PM us, please expect na ilalagay ko na rin po doon na we're gonna read your question. Unless you tell us not to. Kasi po, talagang we can all learn from your questions. And we do not do po private consults. So if you do send us a PM, maglalagay na po kami ng message doon na please expect us to read the question. Unless you tell us na hindi. Okay?
From Miss Weng Reyes, good morning po. Ang sakit po ba na autistic ay magagamot sa habang buhay?
Ma'am, ito lang I'm not a developmental pediatrician and I realized that autism is a big problem. I was trained in the US po. So these kinds of problems are managed po by developmental pediatricians. What I know po is early intervention. Basically, patingin nyo ho kaagad yung anak nyo, they will prescribe PT, OT, and other special educations para po matulungan yung bata to live a normal life. I understand din po that there's a huge spectrum. Merong mga mild, meron pong mga mas serious. A best advice ko po, don't lose hope and consult po a developmental pediatrician as soon as possible. Okay? Kasi po, yung pagde-deny, mas lalo pong hindi po naaagapan po yung problema.
From Mr. Emmanuel Cap Antonio, Doc, good morning. Pag nakakain po ako ng egg, chicken, hipon, alimasag, nag-allergy po ako. Before, hindi naman. Ano po ang dapat gawin? Kasi nagiging dependent na po ako sa mga celestamine or antihistamine. Salamat po.
Nako, Mr. Emmanuel, I'm sorry to hear this. There are really some people po with lots of allergies. Meron din pong desensitization yan eh. Ang advice ko, number one, is to avoid ano po. So, kailangan talaga maging strict po kayo sa diet nyo and to avoid. But there is a desensitization procedure na unti-unti po kayong pakakainin with proper observation po by the allergy specialist. So, my best advice po is really see a good allergy specialist po para we can work on those allergies. But before that, again, maingat po sa pagkain kasi pwede pong maging serious at nakakabahala po talaga yan. I'm sorry to hear this.
From Miss Melot,
okay.
Doc, nanunuyo po ang mga labi ko. May nireseta pong gamot para sa H. pylori at sa acid. Esomeprazole, domperidone, metronidazole at clarithromycin. Side effect po ba ito kaya nanunuyo mga labi sa palibot? Salamat po.
Ma'am, you have likely, na-endoscopy po ba? Anong first name ni ma'am? I think our moderator got cut off anyway. Ano po yung first name ni ma'am?
Doc, nanunuyo daw po yung labi niya kasi may nireseta pong gamot.
First name po nung nanunuyo ang labi.
Ma'am, si Miss Melot Pamintuan po.
Okay, Miss Mela. Dalawa po yung problemang binanggit nyo eh. One is na nanunuyo yung labi and the one is gauging po from the meds. And you mentioned po H. pylori, na endoscopy po ba kayo? And do you have ulcers? Ma'am, I'm not again a gastroenterologist, pero from what I know, hindi naman po nanunuyo. I haven't heard, no, na nanunuyo ang labi po. These are H. pylori meds. H. pylori po, this is the bacteria po that causes stomach ulcers. So, I presume po na endoscopy po kayo, no? So, hindi naman po, at least I haven't heard, ano. I would suggest somebody, meron pong nagreseta po niyan sa inyo. The best thing that you can do is to go back to the gastroenterologist po who did the endoscopy at siya po ang nagpareseta and ask him or her, kung bakit po nanunuyo ang inyong labi. Kung nanunuyo naman din po ang inyong labi, you can try po using petroleum jelly at meron naman pong they're also selling po over the counter po para po like mga chopsticks for your lips. But the best solution po is to go back to the person po who made reseta po yung gamot. Okay? Feel better po, ma'am.
Ako na muna po magbabasa dito kasi Kapampangan eh.
Okay.
Okay, from Miss Ginilyn po ito. Doc, good afternoon po. Para nano po itang prednison 10 kasi po ring adwa ko pong anak doktora mimingal na po. Lalo na po istong atin na pong kuko ang pong sipon. Nano po yung masanting nga vitamins po itang anak kong metong atin niya pong G6PD, doktora. Dakal pong salamat.
Okay, dami pong problems. Thank you for this question in Kapampangan. So, himayin natin ang daming issue, Diyos ko, but we'll go through it carefully, okay? Let's go to the asthma issue or the hingal issue muna. Parang what I read is 2 kids ay hinihingal, especially pag sinisipoan, so that sometimes they get reseta with prednisone. Tama ba ako, Kathleen?
Yes po, Doc.
Yeah, so ganito. Katulad po nung earlier question, one of the reasons po na hinihingal po ang isang tao, bata, matanda, is pagkatapos pong ma-infection. A lot of people po after a very severe upper respiratory tract infection, yung iba naman po after mild pneumonia, parang namamaga po yung kanilang daanan po ng hangin or bronchi. And this causes po, lalo na pagtapos na, kasi during, you could say dahil nakabara po yung mucus. But if it's at the end, no? Usually, nag-inflammation po, ngayon namaga. So, we sometimes give prednisone to, bumaba po yung inflammation. Ang advice ko po, mama, no, number 1, consult your doctor again. Ako po ay hindi ako mahilig magbigay ng steroids na oral, lalo na po sa mga bata. Because we now have steroids, yung pump steroids, pwede po yun. And for kids, they can use inhalers. Kasi di rin po ako mahilig. But if it's only for a short period of time, like 1 day, pwede naman ho, or 2 days. Pero wag pong ugaliin po yung oral steroids. So balikan po si doc. Sabihin, doc, hindi ba pwedeng pump steroids na lang? Okay. Number 2 problem. The most important po talaga, yung mga kids po ay hindi po talaga magkaroon po ng infection para hindi po sila hingalin, di ba? So again, make sure that your kids are properly vaccinated. Flu vaccine every year po yan. And they can also receive pneumovax para po hindi po sila magkaroon ng maraming infection at hingalin. Okay? Regarding the G6PD deficient, wala naman pong bawal na vitamins. I would suggest po yung regular child vitamins lang po, 1 a day, okay? Marami pong multivitamins na tinitinda. Pero, if you don't want naman to give vitamins, and hindi rin po ako mahilig masyado kasi gastos lang yan, the most important po sa mga bata is proper diet. Ugaliin pong kumain ng fruits, vegetables, protein and rice, and hindi naman po talaga mandatory yung vitamins for kids. Kung meron man, just 1, pwede na po. Okay? So, yun po yun. I think I tackled all the issues, the prednisone, the HICA, and the G6PD with the vitamins. So, maraming salamat po.
Yes po. From one of our viewers who sent this question via private message, Doc, ano pong magandang i-vaccine sa kagaya ko na may reactive sa HEPA at may allergies sa balat?
May allergies din ba si ma'am? Yung ba? Hepatitis and allergies?
Wala po siyang nabanggit, pero may reactive daw po siya na HEPA at may allergy sa balat. Ano daw po ang magandang i-vaccine?
Sa balat, allergy sa balat. Ma'am, okay, there is walang bawal na bakuna po sa mga may reactive na HEPA. All bakuna is okay po sa reactive na HEPA. And actually, nag-guest po tayo si Dr. Janus po, one of the most famous hepatologists po sa Pilipinas, classmate and personal friend. Talagang umapila po siya sa mga may hepatitis to get vaccinated. Kasi po yung hepatitis, o pakitype na lang, comorbidities din po yon. So what is comorbidities? Yun po yung mga sakit na na-classify na po ng gobyerno na dapat pong pabakunahan talaga. So, hindi lang po pwede, but the word is actually dapat. And all vaccines are okay for the reactive HEPA. Okay? So, yan po. Yes, go. Bakuna ng si reactive HEPA. Number 2, yung allergies po sa balat. Wala rin po the warning is against allergies specific to the bakuna, and it's really rare po talaga. Ngayon, kung meron naman ho kayong doktor sa allergy sa balat, wala naman hong masama na magtanong. Pero, there is no prohibition po for any brand sa allergies po sa balat. Okay? So, kung may doctor po kayo sa allergies, banggitin nyo po and mention that you are going to have a vaccine. Okay?
Okay, next po. From Miss Arlene Nabaga, Doc, paano ko magagamot o mapapalakas ang lungs ko kung may spare ako sa lungs?
Hindi po, I do not get the question. Pakiulit lang po.
Doktora, paano ko magagamot o mapapalakas ang lungs ko kung may scar ako sa lungs?
May scar?
Scar. Doktora, scar.
Scar. Okay. What is a scar? 99% of all scars. So, sabi, wag naman 99. 90% of all scar is usually from tuberculosis. So, my question is, kayo po ba ay nagamot ng TB? If not, that might be an active TB and dapat pong patingin, okay? Kung nagamot naman po kayo in the past, okay, and that is an old TB scar, then how do you keep your lungs healthy? Number one, do not smoke. Kung meron po kayong kasama sa bahay like si husband, si kapatid who is smoking, then you cannot take secondhand smoke. Number three po is, ano po, of course, you know, talagang pollution is an issue. But if you live in Metro Manila, wala na po tayong magagawa. Kung kayo po ay nakatira sa probinsya, my advice, always, ano po, open air is better than aircon ngayon. Lalo na po protection ng COVID. Number four, please wear a mask. Kasi po, of course, we don't want to get COVID. So, yun lang po. That's how to keep your lungs healthy. And number five, do not become overweight. Bakit? Kasi po, once you become overweight, may ano po, you become more vulnerable to COVID. And ano po, very overweight persons, it is very hard po to inflate their lungs because of the weight of the body and gravity. So yun po yun, maintain a normal weight, don't smoke, don't live with someone who smokes, and always try to avoid pollution. Pwede ba yun sa Pilipinas? And wear a mask. Yun lang po.
Okay. From Miss Jada Zumbulan, hello. Dati, sabi ng doktor, may mitral valve prolapse po daw po. KSU. Hindi na po ako nakapagpa-check up gawa ng financial. Ano kaya ang posibleng mangyari gawa ng hindi po ako nakapagpa-check up ng matagal na panahon?
Ma'am, my best advice to you, imbes na pag-isipan po natin yung posibleng mangyari, magpa-check up na po sila. Okay? How is a mitral valve? What is mitral valve? Where is the mitral valve? Yun po yung mga valves na ano po they protect po there's the aortic valve, pulmonary valve, mitral valve. Most common po si mitral valve, okay? So what I can suggest, pa-check up po kayo kasi po they will do an EKG and an echo and check po rin yung exercise tolerance ninyo. So wag na po nating isipin what could possibly happen. I'm glad na nothing happened. And the most important, pa-check up na po.
Okay. Next question po. From Ms. Kathy Rodriguez. Good morning, Doctora. What is the most aggressive form of breast cancer? What type of breast cancer has the best prognosis? When it comes to cancer,
Ay, ang ganda naman.
When it comes to cancer, I'm really terrified, Doc, because the rest of my family died from it.
Ma'am Kathy, my question to you, if you have a strong family history, ma'am, ang advice ko po sa inyo, pa-check up na po kayo. Like for example, the ones that have family history talaga, colon, lalo na po sa lalaki. Kung si daddy po anak colon cancer, there is a screening colonoscopy for colon cancer. Kung breast po si mommy, then you need to do the mammography. And there are different age-related po talaga. Breast and colon are the ones most frequently screened. Okay? So, what's the most aggressive cancer po na breast? Ito po ang triple negative. That is, the meaning po nito is, it is not responsible, not responsive. There are, yung breast po kasi, there are 3 ways to treat breast cancer na gamot, no? Number 1 is hormonal, okay? Number 2 po is targeted therapy. And then number 3 po is chemotherapy. Yun po yung traditional, okay? So ngayon, kung kayo po ay triple negative, that means yung dalawang hormones po negative. So yun po ang estrogen negative and progesterone negative. So anong meaning kung negative? Ang meaning nun, you cannot take hormonal therapy kasi hindi po siya tatalab. So tatlo, no? Hormonal, targeted, at saka chemo. So down na si isa, wala na si hormonal. Ngayon, second negative, triple negative, di ba? ER and PR, estrogen and progesterone. The third negative po is HER negative. Yun po yung Herceptin negative. So that means po, yung targeted therapy, you cannot take that also. So 2 na yung down. So matitira ka na lang sa chemotherapy. So ma'am, yun po talaga, yung pinaka-aggressive po na cancer is what we call po the triple negative. And pati ho yung outcome nun ay negative. Pero kung kayo po ay ma-diagnose nun, again, take heart, there are always new discoveries every year. My cousin has triple negative but she's been alive for 9 years. Pwede pa rin hong i-treat. But since you asked for the most serious, yun po yun. Again, in terms of staging, stage 4 po is the most serious stage. Ang meaning po ng stage 4, kalat na po sa buong katawan ng tao. And when someone is stage 4, hindi na po natin sila mapapagaling, but definitely, pwede pa naman pong habaan ang kanilang buhay. So don't lose hope. And then, probably the mildest po, yung talagang early breast cancer. Yung mga tinatawag pong ductal carcinoma in situ, DCIS, pinag-uusapan nga rin po natin with Dr. Emmy Kua de los Santos, last ano po. No, once you get a breast cancer that's really early, pwede naman pong tanggalin po and no chemo na eh. So, it is very important po ng pamammogram para maaga po nating makuha stage 1. Meron pa nga stage 0. And then, madali lang ho ang gamutan nito and you have a really good outcome. So, yes, it's good to be terrified, pero di lang po tayo ma-terrified, dapat po gumawa naman ho tayo ng paraan so that we could be diagnosed early. Okay, Ma'am Cathy, don't worry so much.
From Miss Annabel Campos, hello po. Tanong lang po kasi, nakagat po ako ng aso at pusa. Okay lang po bang magpabakuna para sa rabies? Kasi po kakatapos lang po ng first dose ko last October 13. Tapos po second dose ko naman po sa November 3. Maraming salamat po sa pagtugon niyo po sa aking tanong.
Miss Annabel, tama ba? This is such a beautiful question. Ito lang and this happened po to sa cook namin si Manang. Kasi Manang, after first dose of AstraZeneca po, kinalmot ng dog. So, she was actually sent home po from the ER and told na hindi po na pwedeng magpabakuna. Pero clarify na po ito ng DOH. You need to get a rabies vaccine po. Lalo na po if malalim, dumugo, di nyo kilala yung dog or cat o yung mga pusang gala. Why? Kasi po, ang rabies, there's no gamot. Diretsong patay po yan if you really get rabies. So, you need to be vaccinated regardless po kung nabakunahan po kayo ng COVID, first dose, second dose. Importante po talagang mabakunahan ng rabies kasi po nakakamatay po yon and there is no gamot. I would like to repeat there is no gamot po for rabies. So, let me give you this example. Kayo po ay pumunta sa vaccination center, okay? Let's say, then, nabakunahan kayo ng first dose. Okay. Going home, yung kapitbahay nyo pong dog, kinagat kayo. Narinig nyo po na asong ulul po yun. You need to go to the animal bite center, to the rural health unit, to the public hospital, and agad-agad nyo pong pabakunahan yung sarili nyo. Kahit na the day before o pauwi kayo, nabakunahan kayo ng COVID. Okay? Because rabies is deadly. Ayan. So, thanks for that question and please, klinaro na po ng DOH yan. Nagkaroon po ng confusion but now they know that they need to vaccinate po for rabies. Okay?
From Miss Clines, Taruk, Doc, yung pancreatic pseudocyst po ba, PWD o operahan?
So, a PWD had a pancreatic pseudocyst. Tama ba ako?
That's how I also understand it, Doctor.
Ma'am, ang best advice ko sa iyo, see po a liver surgeon. I cannot answer that question kasi I don't know how big is the pancreatic pseudocyst, kung meron pong naiipit na mga bile ducts po that are causing you to have jaundice and possibly infection. So if you've been diagnosed po with a pancreatic pseudocyst, you need to see po a hepatobiliary surgeon. Paki-type lang. Opo, eto po. Wait lang. I will write it down. Opo. Hepatobiliary surgery. Ayan po. So, yan. I just have type it. You need to see po a hepatobiliary surgeon or a liver surgeon. Two of the most prominent in the Philippines, Dr. Samuel Ang, Chinese General Hospital, and Dr. Tony Perez, Philippine General Hospital po. Don't just go to any doctor kasi medyo problem po talaga. If you do have a pancreatic pseudocyst, parang na-work up na po kayo, ma'am, because parang alam nyo na ho what your illness is. My suggestion po is to consult, I'm sure you saw a surgeon already, or a gastroenterologist, consult nyo po. A lot depends on where it is, the problems that it is causing, gaano po kalaki, And of course, what is the health condition po ng ating PWD? Ito lang po for those who are going to undergo surgery, one of the questions po that we answer is, kaya ba nung taong magpa-opera? Kung talaga pong the person is in a bad condition, baka ako mas makasama naman po. But if the person is in a good condition, then they may be able to do good po sa surgery. Again, I cannot answer that, and you have to consult po yung surgeon. I do not see hepatobiliary surgery coming out, but it's okay. So yun po yun, liver surgeon or hepatobiliary surgery. Okay?
From Miss G. Lumba, good morning po, Doktora. Ask ko lang po sana, pag po ba may emphysema at third degree AV block yung patient, hingalin po ba talaga sila, Doktora? Thank you po, Doktora.
Well, ano po, yung emphysema definitely po, especially if it's more serious, yan po ang tinatawag nating chronic obstructive pulmonary diseases, o we abbreviate this into COPD. There are two kinds, chronic bronchitis po and emphysema. Emphysema is yung na-overstretch po yung baga nyo. And for those who are smoking, please listen to me, okay? Ito everybody who's listening, try this. Take a deep breath. Reina, did you take a deep breath? Kathleen, did you take a deep breath? Okay. Yes. Doy ba to? Mr. Doy, did you take a deep breath? Okay. That's a normal lungs, okay? Ngayon, take a deep breath. Okay. Hold. Take a deep breath again. Ang hirap. Okay, ulitin natin Take a deep breath. Hold. Huwag ilalabas. Take another deep breath. Okay, ang hirap pag take a deep breath, nandun ka na sa taas, tapos hold, then deep breath. Ganun po yung buhay ng emphysema. Kasi overstretch na po yung lung nila. And then, yung hinihinga nila, yung take a deep breath po, dun sa taas na lang nung the second take a deep breath. Naku, nagets mo yon, Reina?
Yes, Doc. I've seen an emphysema.
Yes, take a deep breath. Huwag niyo ilalabas hold. Then huminga kayo doon. Yun. Nakuha nyo? Ikaw, Kathleen, did you get it?
Yes po, ang hirap po.
Ang hirap, okay? People with emphysema and chronic bronchitis, alam mo ba, just taking a shower is a nightmare. Kasi yung steam na lang, the water, the hot water, oh my gosh. Talagang, di na sila makaligo sa sobrang hina po ng kanilang baga. Okay? So, I'd like to say this, okay? For those who are smoking, once you lose lung tissue, hindi na po babalik yan. Kahit na ano pa po ang gawin ninyo. Pwera na lang po ng lung transplant, okay? So, what you need to do is stop smoking immediately para yung decline po ng inyong lung function ay bumagal. But you can never recover lost lung. Okay? So, please, listen to that and don't smoke. So, that's the reason why people with emphysema ay hinihingal. Okay? Third degree AV block, pa-check po sa cardiologist nila.
From Ms. G. Lumba, Doktora, yung sildenafil 25 milligrams po ba, malaking tulong po ba sa kanya yon? Thank you po, Doktora. I think this is a follow-up. This is a follow-up.
Sorry, hindi ko po
Kay Ms. G. Lumba, Ms. Kat, paki-flash po ulit kay Ms. G. Lumba. Po yung may third degree AV block na patient po na may emphysema. So, niresitahan
Viagra yun
ng gamot. Ayan. Ako.
Sildenafil po is Viagra. We do not use this for third degree AV block. Please don't use this, okay? If you have po any cardiac problem, please be very cautious when you use sildenafil or, tama ba ako? Sildenafil or Viagra, okay? There have been cases po that, am I answering the right question? Sandali lang.
Yes, Doktora.
G. Doy, sorry, I cannot read it. Pasyensya na po.
Sildenafil 25 milligrams from Ms. G. Lumba. Ito po yung follow-up question niya dun sa may emphysema po kanina.
Emphysema and third degree AV block.
Yes po,
Okay,
Dok.
what is sildenafil? First and foremost, pakilagay lang in big letters, Viagra. Okay? Ito yung pinag-usapan natin with Dr. Dodge Limhoco. Viagra po is a best-selling drug actually na ano po nagpapalaki po ng blood flow into the smaller vessels po of our organs that includes po yung penis. Kaya yung mga hindi po tinatayuan na lalaki, they do use Viagra. Okay, caution na malaki to, no? May third degree AV block po yung tao. So, I am assuming may problema po sa puso yung taong yon. I don't know if this is male or female. I am assuming na lalaki po ito because not many people use female po na Viagra, no? So, if you have a problem po with your heart, please, ang dami pong tinitindang sildenafil Viagra sa mga internet, do not use it. Kasi po, you need to be cleared by your cardiologist kasi po, bigla pong bubuka yung mga small, smaller blood vessels, baka hindi po makayanan ng puso. People have been known to have cardiac problems upon using Viagra. So baka naman humali yung gamot nyo. I don't know, opo. But please, if someone really has third degree AV block or cardiac problem, pa-check po muna sa doktor. I am not saying don't use it. I am saying check first from the doctor just to be sure. Okay? Ang gamot po, ang gamot po sa COPD po are usually inhalers. This includes Ventolin, long-term inhalers po, and inhaled steroids. But again, there are not many good drugs po and there are not many good drugs for emphysema. So please take care of your lungs, okay? Sildenafil is not the drug of choice for third degree AV block. Unless nagkamali po ako, please don't hesitate to put a message po, okay?
Doktora, inuulan po tayo ng tanong. So, very
Okay,
short.
pass na lang po. And then we'll stop po around 45 minutes, okay?
Yes.
So siguro last 3 questions.
Last 3 questions from Ms. Cathy Ramos Lahom. Doc, both kidney ko po ay maga. Nagkaroon po kasi ako ng kidney stone last year. Pero naoperahan na po ako, pero yung pamamaga ng kidney ko, hindi na daw po mawawala yun. Pwede po kaya ako magpa-vaccine? Hindi po kaya makakasama sa kidney ko ang vaccine?
Okay, that's a very good question. I'm happy to hear po na nagpa-opera na po kayo for the kidney stone. Unfortunately, it left you with kidney problems. So ganito po, ma'am, and we had some of the most prominent kidney doctors po talaga sa Pilipinas, no? For those with kidney problems, and for those na talagang nasa dialysis situation na po, hindi lang po pwede, but the word is dapat. Kasi po, kayo po ay meron tinatawag pong serious na po yung problema, lalo na kung nasa dialysis na rin po, no? So, it is very important po na maprotektahan po kayo from COVID. Because if you do get COVID, matindi po yung tama ng sakit sa atin pong bato, and a lot of COVID patients are actually even dialyzed. So, ma'am, don't worry po about the effects of the vaccine on your kidney. Very, very minimal po, and it is not well known po na magka-problema po sa kidney. What we need to worry about po is the effect of the COVID on the kidney. So, my answer to you is, yes, magpabakuna na po kayo. If you are concerned or worried, the best thing to do po is to go back to the doctor po na nag-diagnose or nag-opera sa po sa inyo at banggitin nyo po, you may want to ask for some questions or clarifications. But in general po, all kidney patients and most especially those na nasa dialysis na po should be vaccinated for safety kasi po pag na-COVID sila, mas matindi po ang tama po sa kanilang bato. So thanks for that question, and guys, lahat po ng may kidney problems, high blood, sakit sa puso, pabakuna na po sila.
Alright, from Ms. Laarnis Y. Clemente. Hello po, Doktora. Mababa po ang red blood cell ko. Mas malamang po ang white blood cell ko at minsan po may dating na para akong nililindol. Ang gusto ko po sanang i-take sangobion para po sa dugo. Okay lang po ba yun?
Pakiulit lang po ng tanong. Sorry, mahina kalaban.
Si Ms. Laarni has mas mababa yung red blood cell count niya versus the white blood cell count. And then, she is feeling na parang nililindol. Lagi, parang nahihilo. Gusto niya daw sanang i-take is sangobion para sa dugo. Okay lang daw po bang i-take ang sangobion? I think this is a supplement.
Anemia question, okay?
Yes po.
Ma'am, thank you for this question. Ano po? If you are perennially anemic, a very good question po dito would be your age, okay? If you are, I don't know how old you are. If you are really anemic po at matagal na po, no? Before you take iron, ferrous sulfate, sangobion, or these kinds of things, we need to ask the question, bakit po kayo anemic? So that requires po a workup. Kasi po, there are many issues. Number one, that's why I asked the age. Females of childbearing age po could be anemic due to malakas ang regla. If you are older naman po, you need to be checked up din po kung matagal na po yung anemia nyo. Kasi po, colon cancer is also one of the reasons that could cause long-term anemia. Makabigay po tayo ng bigay ng yung pala may naalaga na po tayong colon cancer dyan, okay? And then number 3, there are also persons po na, they have, the Philippines is notorious po for thalassemia. So, thalassemia po is a chronic anemia and it's long-term. Ang sagot po dito is not iron tablets. Ganun lang ho talaga yung mga tao. So, my best advice to you po is, number 1, find out the reason why you are anemic. Kasi po yung pinsan ko, took iron tablets for like 10 years. Yung pala, she was thalassemic. Okay? So, the most important question, kung matagal na rin po talaga yung anemia nyo, and it's really quite low, another question, do you have kidney disease? Kasi po yung mga may kidney disease, mababa rin po yung dugo nila. So, the most important question, before we just give vitamins, is to answer the question, bakit po kayo may anemia? Okay? And once you know that answer, then we can decide po what to do. Kasi I'm so worried, some people just keep giving iron, some doctors, persons taking iron, ganun po, without knowing the real reason. And potentially po, pwedeng po maging serious po yung rason. Okay? So, alamin muna bago uminom po ng gamot. Yun lang po.
From Miss Christina ang Domingo, Doktora Ana, ask ko lang, pwede po ba mapabakunahan ng COVID vaccine ang aking 15 years old na anak na G6PD+. Positive, G6PD. Thanks, Doc.
Okay, this is very interesting question po talaga because we have just started vaccinating po children. Ngayon, there is a list po of comorbidities sa mga bata, Reyna. Unfortunately, I am not a pediatrician. So, hindi ko po alam if G6PD deficient is located po in that listing. So, ang best advice ko po, ma'am, balikan niyo po si pediatrician. Alamin niyo po kung eligible na po yung inyong anak, if G6PD is a comorbidity, and pa-advise po kayo sa pedia. Unfortunately, I'm not a pediatrician. Sa mga adults po, masasagot ko lahat yan. But siguro maybe it would be very interesting po to guess the pediatrician dito. 'Di ba, Miss Reyna? Kasi bagong-bago pa lang itong bakuna for kids. Yes, and I'm sure marami pong parents are so interested po sa isyong to. Let me look for Dr. Tina Alberto and ask her. Okay?
Okay, Doctora, that's the last question because
okay.
Almost.
All right. Sige, may humahabol na isa. Last na talaga.
From Cheryl M. Apile, ano pong pwedeng mabili na gamot para po sa allergy dahil sa belt po? Kinamot kasi Makati kaya lumala po. Yung Calmoseptine nilalagay ko pero di pa din okay po. Dito, I think she's saying na sa may belt area nagkaroon po siya ng allergy. Kinamot niya ng kinamot dahil Makati. Ayun, lumala daw
Yeah,
po.
you could put po an antibiotic ointment kasi baka ma-infection na yon, okay? One thing I'd like to make sure that it's a belt allergy kasi sometimes, especially if you're diabetic and you sweat a lot, pwede pong fungal infection so patingin lang po, okay? And the most important po sa mga ganon, try to wear loose clothing, okay? Kasi lalo na po pag summer, it gets very hot, okay? So yun po, just make sure it's an allergy. Kasi po pag diabetic kayo, sometimes you tend to scratch, ako talaga mahina sa derm, sorry Rains. But best advice ko po, patingin po sa derma. Nagte-telemedicine po ang mga derma ngayon.
There you go, Doktora. That's all that we have po.
So to everyone po, stay safe this Halloween and take care po. Salamat.